Good day. My name is Dr. Obinna Ebirim. I'm a medical doctor, public health physician, and health promotion specialist. This is one of the topics under the public health vaccines and immunization course. As you know, public health is the act and science of promoting health, preventing diseases, prolonging life, and ensuring good quality of life through empowered and well informed individuals, communities, and societies. There are various parts of public health, biostatistics, epidemiology, the common ones, health promotion, but then we also have things like health, public health policy, environmental health. And one of the common environmental disaster in Nigeria is flooding. So today we are going to look at the management of flooding. As part of the outline, we're going to do a brief introduction, the history of flooding, then we will narrow down to the 2013 flooding in Nigeria, look at the causes and types of flooding, we'll look at the effects of flooding, and then concentrate more on the health effects both during the flooding and after the flooding. And then we'll then go into the crux of the matter, which is how do we then manage it using the management cycle, after which we'll then conclude. So in terms of introduction, one of the major threats the world faces today is the effect of climate change, and that is why there's a global solidarity and effort to curtail the negative actions that lead to climate change. And flooding can be attributed to those activities that lead to climate change. So climate change is one of the causes of the flooding we see. It's indirect, causing the water levels to rise. Yeah, but beyond climate change, there are other causes. Other natural disasters that occur, we have earthquakes, volcanic eruptions, landslide, heat waves, and they, like flooding, also require management, a management plan that prevents the harm, a lot of harm, or mitigates the harm that results from these natural disasters, or in some cases man-made disasters. So what actually is flooding? Flooding is the abnormal presence of water on land, not usually submerged. So the land is not submerged, but the water on land is to a depth which affects normal activities. So once the water collection in land is such that it affects normal activities, but not that the entire place is now submerged, then that is flooding. So these natural disasters, they require extraordinary response, and they have a whole lot of effect, from deterioration of health, loss of human life, death, and ecological disruptions. And usually flooding should not be a natural disaster, but it becomes catastrophic when there is no prevention or mitigation plan, when there is lack of preparedness, when people refuse to adhere to warning, or when there's inadequate response and recovery. Now, in terms of history, the first ever recorded flood known to mankind was the biblical time of Noah, where Noah was asked to take at least a male and female of all human species, plants, and get into the ark, as there will be flooding. But then, beyond the biblical times, as early as October 1634, there have been a recorded flooding in the coast of Germany and Denmark, which resulted from the North Sea. But the deadliest flooding that ever occurred is the one that occurred in China in 1931, where about over 3 million lives were lost. The first flooding that was recorded in Nigeria was the Ibadan flooding of 1948. But then we have had flooding that have claimed a lot of life, like the Gumpa flooding of 1980 that claimed 200 lives. The current flooding that happened in 2013, it actually began in July 2022 and had killed about 363 people and displaced 2.1 million Nigerians. That's the 2013 flooding. So that is a huge loss to the nation in terms of deaths and also disruption of activities. So then there is this Banguda Dam collapse in 1988, August 1988, that killed 142 persons and destroyed 18,000 houses. So these are kind of the history of flooding and its effects in Nigeria. Why we are giving this history is to show that flooding has been here for a long time, and then it's something that has been very, very disastrous in terms of its effects. So let's now narrow down to 2013 flooding in Nigeria. About 140 people have been killed only in 2013. Remember that it started in 2022 and the total deaths have been up to 363, but only 2013 we have 140 persons have been killed, including 25 that has been killed in Lagos State and 100 in Ibadan. There have been also heavy flooding in Kano, Katsina, Jigawa, and Sokoto up north, and then in Enugu and Kaduna State just a few days ago in October 2013 they were reported flooding. The Nigerian agency that is in charge of predicting flooding, sunshine, the Nigerian Meteorological Agency, predicted that several states could be submerged at the end of 2023 due to the large-scale rain, and that this can affect about 25 million Nigerians living in coastal population. You know, Nigeria has a population of about 160 million in 2023, and that is estimated to grow even further. So the 2013 flood in Nigeria was actually a catastrophic disaster that required management to reduce its impact and prevent reoccurrence. So what are the causes of flooding? So it can be natural cause or man-made. So natural causes of flooding are things like heavy and torrential rain. It's usually seen in areas with coastal areas, like when it rains heavily in Lagos, in Port Harcourt, in Bayelsa, you can have flooding. And then ocean storms, tidal waves, usually along the coast, can also cause big body of waters to overflow and lead to flooding. So these are the natural causes. But then you have human causes, like large water pipes can burst, the dam can burst, dam can spill. Like the 2013 flooding was caused by a dam spill, issues around a dam, and that then spilled and caused the flood now 2023. So there are different types of flooding. You have the coastal flooding, the river flooding, the flash flood, the urban flooding, and dam related flooding. As I say, the 2013 flooding is a dam related flooding, and so it's more like a human cause and not a natural disaster. So then what are the effects of flooding? There are a whole lot of effects. Crops, livestock, agricultural facilities can be damaged. Water bodies can be polluted due to washing away of what's called refuge into now body water once the flooding, and then causing scarcity of water, especially where the source of water is from rivers, and it can also damage, obviously when there is flooding, can damage residential building, commercial building, educational building, industries, and all sorts of building. Wildlife can be lost, can lead to killing of wildlife and their habitat. It can lead to high cost of living because then there will be a lot of scarcity. Some social amenities will be up, and then people then have to, that is provided free of charge. And then there could be socio-economic loss due to grounding of activities. Sometimes power would go down, the various maybe internet supply will go down, and so a lot. The net effect is that because poverty and hunger will be. Some people cannot go to work. People who eat hand to mouth are not able to go to work. So, and then there are also health effects which we are going to narrow down to. But then those health effects are things like drowning, spread of infectious diseases. Sometimes we cannot even have access to health facilities, and there is now limited access to health. So let's look at the health effects during flooding and after flooding. So when there is flooding, you can hear things like people are drowning. There could be houses can collapse, and then people would fall, have fractures, skin cuts, and then power lines can fall and people can be electrocuted. So those are the things that happen. Sewage can overflow, like open sewage or sewage that has vents. Water can then rush into it and overflow, contaminating drinking water and recreational water. Right? If there are swimming pools around, can contaminate it because of sea overflowing. Then, if people are not drinking infected water bodies, can lead to all types of waterborne infection. And then diseases that their host is water borne, can also, things like malaria, dengue fever, and all that can also be on a rise. The flooding can cause reptiles or animals that already confined to the wild to then flow into living areas, like causing things like snake bites, reptiles, and other animals. So these are things you have. Then due to the flooding, there might be closure of schools, hospitals, and that results to maybe flooding routes can even prevent people from having access to hospital. So people are now denied both preventive and curative health access. So these are some of the health effects of flood during flooding. But then after flooding, some of those effects during flooding can continue long after the flooding is over. But then, as you can see in this picture, moats can form, and then you have health effects secondary to these modes forming due to damped areas in building, like brain damage, eye and nose irritation, asthma. It can trigger asthma, and then other allergic condition. Can be also outdoor air pollution. People who died and there was no access to emergency services to come and or dead animals or humans or even refuse that are washed, and then it can cause outdoor air pollution. People will be depressed, have mental disorder due to they are now confined. Some of them have lost access to social amenities. Some who depend on their daily activities for food. So it can lead to a lot of depression and mental issues and psychological disorder. And some of the follow-on effects is people can then take into alcohol and drug abuse to try and get solace from that, which in itself does not, in the long run, offer that solace. And then also in the long run, because a lot of people coming down with diseases, it's put a strain on healthcare facilities and staff. So these are some of the things that the health effects of flooding. So as you can see, flooding is a huge issue that deserves our attention in terms of management, so that when it occurs, as environmental health specialists, we would know how to manage flooding. So now we go into flooding. Now, one important thing to note is that flooding is not something that is only managed by people in health. It requires a multidisciplinary, multisectorial approach, right? Then, but to kind of discuss the process of management, we're going to use disaster management cycle. But then, what you might not see in this disaster management cycle is that there is usually an initial assessment. That initial assessment is very important and usually done to then get baseline information that would help and also know the scale, scope, and know if there are people in distress. But then after that, then you can now use this disaster management cycle to know how to respond, and the process includes emergency response, ongoing relief, recovery, and this basically is for the current disaster, right? But then the other things you also do to prepare for the next disaster, which is disaster prevention and mitigation, together with lessons learned from disaster, disaster preparedness, then warning ahead of the next disaster. So it's a cycle where you learn from the activities of the current disaster in order to prepare for future disasters. So let's go through the processes. The first is initial assessment. It entails on-site visual assessment from maybe an aircraft or high point, or you can use satellite imaging to really understand the scale and scope, right? Expert measurement testing survey to ascertain level of damage and derive statistical valid information, right? So it's basically to have an understanding of the scope, scale, and nature of this disaster. You can also interview informant, community leaders, group, and affected persons to really understand. So it's an important step, initial step for that you assess to understand before you then begin the response. In terms of response, there are two important parts of response. There is the search and rescue and the relocation. In search and rescue, you find trapped people, you provide immediate life support, sometimes CPR will be needed. Then you transfer them to the forward reception point. That's an emergency point that have just been prepared to take people, right? But remember that point must be safe from this disaster, or in this case flooding. Then you recover the dead for burial in dry prescribed land. So you take them away, you do not bury in the area that is flooded, and thereby enhancing contamination, right? Then you provide temporary support, repair, demolition, things that will cause further damage. Like for example, if there is a power line that is almost broken but it has not fallen, and if it falls, it can cause widespread electrocution. You might need to want to then keep it, provide a support so it doesn't touch the body of water and then cause additional electrocution. So you just provide those temporary support, repair to prevent further harm. And then it's important, as I mentioned, the response is multi-sectorial, multidisciplinary response. So you provide the support and then begin to ask for other services and specialist units to come and join. Having done that immediate search and rescue, the next thing is to relocate people. You need to then move people to safe havens, right? Begin to move things like artifacts, livestock, properties, endangered species. Begin to move them, humans, to a safe haven, right? And remember that it should not be a place that is prone to flood. You don't want to take people and then once flooding begins, that place becomes flooded. So you take them to where there is no flooding, and they should also have access to the amenities, right? So these are the quick response, the emergency response that is taken as the first step after the initial assessment, right? You want to go in quickly because once you do this very quick, you save life. Then after the response, you then go to ongoing relief, right? In ongoing relief, what the important points are, you are communicating, telling people, okay, what to expect, what government is providing, what the opportunities, if there is a medical outreach center that has been developed, how they can get food and all that. So communication is important in ongoing relief. You then you remember that in search and rescue, those people that were rescued are moved into the forward reception point. Now you need to then begin to move people and into the backup reception facility that is more arranged, more categorized. Then you have to think of transportation, food and welfare resources. Now, whenever there is disaster, there's always rising of people tend to break the law, and there's a lot of disorder. So you have to also get the military, police, and the law enforcement agency to ensure maintenance of law and order. Then you have to think of how do you manage sewage, hazardous material, and the debt to ensure that they are properly disposed of, so that they are not constituting health hazards to those that are living and survivors. You think about firefighter must be in place, power supply must be restored, public works and engineering needs to start repairing, especially things that have the potential of causing more harm. Then you also think of the health and medical service that needs to be provided, because people are likely going to fall ill because of the effects of flooding. So let's narrow down to the health and medical services. So it's quite key during flooding and for flooding victims, and it's something that health and medical services are provided not just during search and rescue, but even up to recovery, right? And they must be included. They must be included in the prevention and mitigation plan and the preparedness, right? So it's something that is required in multiple levels of the natural disaster management cycle, right? And you need to have a team under a leadership, and that team would have people from different spheres, people in charge of public information, people who are requesting donation to support, people who coordinate the volunteers, people in charge of transportation, supplies, repairs. In health, core health, you need ambulance and hospital to be running. You need environmental health people. You need epidemiological and surveillance too. So it's a multi-sectorial team, right? And you require them in various parts during the search and rescue, as I said, at the forward reception point where they are taken to during the search and rescue, up to the backup reception point during the ongoing relief, right? So these are important points where you need health and medical services. And then, as we said earlier on, it must be multi-sectorial and multidisciplinary approach, because you need a lot of people. The major roles that these health and medical service specialists provide during disasters such as this is health sensitization, talk, planning prior to flood, like this we are doing right now can pass as health sensitization, where it teach people how to prevent and plan for flooding. Triage and first aid are during rescue, search and rescue. So you then categorize people according to how severe and how easy, how accessible is the health services they need. There's need for ambulance services to move people. Even when people even get to the health facility, they need to be triaged and then provide emergency care. You have to treat people. You have to coordinate drugs and utilities. As you know, transportation might be affected, so you need to think through how you make sure there's adequate drugs and utilities, health utilities to meet the service. Then you have to look at the public health needs of the community. Remember that with flooding, there will be emerging needs, health needs, public health needs. So that needs to be managed. People would become depressed, as we saw in the health effects. Will be depressed, have psychological breakdown, increase in drug abuse. So you need to have a mental health management plan. You need to also have nutrition health. There's going to be food scarcity. People might begin to get malnourished. So you need to make sure that you have a plan. Environmental health management, there's a lot of environmental issues we've discussed. So you can see there's a whole lot of health and medical and health services that can be provided during disasters such as flooding, and they are important in various levels of the management plan. So after you've had your initial the emergency response, in ongoing relief, the next one is recovery. And in recovery, what you're trying to do is you want to restore people's means of livelihood. You want to begin to open up, clear the road, make sure the stores are opening. You want to repair and rebuild damaged housing and infrastructure. Those that have been affected, you want to rehabilitate them. Some people will have post-traumatic stress disorder. Some people will go into drug abuse, alcoholism. So you need to rehabilitate them. Some people require support, so there's need to coordinate support and donation to support those that have gone into catastrophic that people that are now in need of support due to the disaster. Then you have to coordinate sharing of relief materials, and then very important, you need to do a post-flooding assessment and analysis, because that will help in the prevention and mitigation and the preparedness for the next disaster. So having gone through recovery, then we'll then prevention and mitigation. So in prevention and mitigation, what you want to do is that you might not be able to prevent flooding from occurring, especially if it's natural disaster, but you want to it not causing emergency or lessening the effects. So basically, you are doing to trying to reduce susceptibility and likelihood. The likelihood that it will occur, and if it occurs, the lesser likelihood that it will cause harm, right? And things you can do is that you can provide source control, reduce runoff, storing the runoff, increasing capacity of that. These other things we'll look at the various measures in the next slide. So one of the things you do is a source control to reduce runoff. What do you mean there is reduce? You try to plant trees and then construct pavements and what we call in Nigeria gutters that will absorb runoff rainwaters and so release them to atmosphere through evaporation, right? And trees also taking water. So you plant more trees, construct pavements that will hold water. Then you can also store the runoff water by creating detention basins, reservoirs. You can reduce the peak and ascent of flooding. This can then absorb the runoff water and then reduce the peak and this thing. And then using that collected water, you can even provide the drinking, live well, treated, and even agricultural water needs of the community. So apart from controlling the reduce the runoff, you have to store. Also, you can store the runoff. The other thing to do is to increase the capacity of the river. You can also dredge rivers by increasing it then, or construct bypass channels. But the one thing to note is that increasing capacity of water can lead to flooding in downstream areas. So other things we can do in terms of prevention and mitigation is that you can separate the river from the population. So things like you can develop embalming, flood proofing, and house raisings. Then beyond these interventions, you can also use public health policy where you enact legal and administrative control, including laws that prevent people from blocking pavements, not building in areas that are water that have pavements or blocking pavements or then doing. There are so many laws, right? Practices like also dumping illegal dropping of refuse can then block those water pathways, and then making sure that building control that people are being right. So those things are things you can use legislation and laws and regulations to. You can enact laws and regulations to use and prevent flooding. So after prevention and mitigation, that's making things that reduce the likelihood and susceptibility. Then you know that we have not said that we are preventing totally from happening. So the next important step is what we call preparedness, where you prevent the loss of lives, property, environment from flooding through the efficient use of resources that can be easily mobilized, right? So the two parts of preparedness is basically you have to develop policy that will help, and then you have to plan. So policy is basically you have a formal statement in place on what needs to be done to ensure coordination and better results. So you should have like clear policy guidelines. This is XYZ will happen. Policy guideline in terms of health, in terms of construction, in terms of fire, in terms of environment. Things you predict the various things that happen. You have a clear written statement on how to follow if such happens. Then planning is the actual coordination in which individuals and organizations are aware of their rules and areas of interaction once that disaster occurs. So let's go down to look at what does planning entail. So in planning, first you define, and you want to know the rules, aims, scope, content, tasks, and resources required. So you define all that. If flooding occurs, what is likely scope? What is the rule? Who and who is required? Right? What are the resources? How much do we need? What and what needs to be done? You define all that clearly. It's just all you want to define so that you know, right? And then you then begin to decide on which group and who in that group will be required. So you need people from the fire service, you need people from the law enforcement, you need public health, environmental health, you need health, emergency physicians and all that. So you need to plan and know that. So you review the various groups that are required and who in that group will need to be called upon, and there's clear rules and responsibilities. Then the next one will be to analyze potential problem, right? So you break down the possible things that can occur during a flooding disaster, right? We mentioned some of them like health issues, infrastructural breakdown, break down in law and order. You then break down the various problems into the various segments and develop innovative and effective strategies to deal with them. So the first one we have defined, right? Just defining different things. After defining that, you then set up the group. You know the various group people that will be needed, what they'll be needed for, and all that. That's the planning group review. The another thing with problem analysis, identify the problems and that can occur and the innovative solutions to address them. Then you then review the resources that will be required, right? Review the resources that are required. What money, what tools, what capacity do we need? Do we have all that, right? You make sure they are valuable and in place, and how you can quickly mobilize them in case of disaster. After that, you ensure you describe the roles and responsibility and apply it to the various planning the groups that we have identified during the planning group review. Then you also talk about what's the management structure, because since it's a multidisciplinary and multi-sectorial response, you need to make sure you have all the teams in place and ready, right? And then there should be a leadership. So it is determine the leadership structure, the management structure, who will be in charge. Are there going to be teams who are going to lead all teams? How will the teams report to the greater team, right? And then having put all this, you then put them together to develop a clear strategy and system that you now put in place for the disaster when it occurs. So that's what planning takes. These are the components of planning, and we are using this emergency planning process model to know what it takes to plan. So having done your prevention and mitigation, preparedness, the next one is now the disaster is close. You have to warn people. So warning is a timely prior information to the people of the impending flooding or any other natural disaster, its nature and area that will be affected. And then that warning should also come with plans that have been put in place to relocate people who are expected to be cut off. So it's not just tell them, oh, it will happen so place and thing, but what are the plans, and then what are the other things, so that will build from the planning that have been done. Remember that in the preparedness we had to do a planning. So in that planning, we developed a clear strategy and system. We put a clear system in place through all the processes we did. So that needs to be communicated to people and say, okay, this is what is available, this is how you can get it, these are the people that are in charge, right? And then you need to use effective communication tools. So if, for example, it's a remote area, there's no need using social media. You have to then use tools like town criers or radio that are utilized by people in that local community. So basically, that is the end of the cycle that started from the emergency response, ongoing relief, recovery, planning and mitigation, preparedness, and now warning. So that is the disaster management cycle, and now warning is the last one. So I hope that you now know what it entails to manage a disaster, most likely an environmental disaster like flooding. So in conclusion, flooding is a common natural disaster in Nigeria, and also sometimes a man-made disaster like the 2013 flooding that we use as a case study here. It becomes a disaster when there is no prior planning or attempt to prevent and mitigate. Otherwise, flooding can occur if there is proper planning and warning and people adhere to that warning. Then there might be flooding and there won't be loss of life and harm. In fact, with proper planning in some areas that are prone to some natural disaster, the houses that are built there are such that they can withstand the effect. So this presentation is basically a sensitization program for a flood-prone area on how to manage flooding, and this management starts even before the flooding is there. So, in summary, in planning for disaster, a stitch in time saves 9. We have to begin now to prepare for the next disaster, and it requires planning that starts from, if the disaster is already there, initial response, ongoing relief, recovery. Then we begin to prepare for the next, prevention and mitigation, preparedness, and warning. for the next when the time is close. So thank you all for listening. I know it's a long presentation. I look forward to your questions and your comments. Bye bye. This is the reference material I used in developing this presentation. Thank you.